We first told you the story of Cathy and Carl Summars last summer. I spoke to their children today about how they're honoring their parents' memory 1 year later. The first few notes of this song and Samantha and Raylon are transported here. Carl singing and strumming for the family for the last time before Carl and his wife Cathy died of COVID-19.
Hearing the first note coming out of that guitar, it's those things that they'll get you every time.
The memory's still painful as Raylon plays his father's guitar.
You still have those memories that come up, the random song that plays, or the story that gets told that brings back, not only the happiness, but also the sorrow.
Just over a year ago, Cathy and Carl Summars spent their final hours here in Tanova's ICU. The couple, married for 42 years, died just 2 hours apart.
They chased each other to the end, and that's the solace that we have, is that they're still together.
In the years since, Raylon and Samantha say they've honored their parents' memory by sharing their love.
The important part is to remember their love and to share that with people.
And they say for the family, their parents' death was a harsh lesson that tomorrow is never guaranteed.
Don't live happily ever after. Live happily ever now, because you do not know.
And since the pandemic began, 161 people have died in Bradley County from COVID-19.
Right now, you don't want to stub your toe because we don't have a place to take care of you.
With COVID on the rise in Hamilton County, several challenges have been presented to medical professionals.
But oxygen has something the hospital has had to work very diligently and be proactive.
The Georgia Hospital Association says some smaller rural hospitals began to see shortages about a little more than a week ago. Governor Brian Kemp renewed a waiver on weight limits for trucks to help get oxygen to the hospitals that need it. Dr. Carlos Baliero directs pulmonary medicine at CHI Memorial. A few months ago, they did run into some issues.
They had to activate some of the shutdown valves and redistribute the patients because of the pressure demands on the system.
But he says it doesn't qualify as a shortage.
We have not had any problems with shortage.
And Dr. Jensen Hyde says it's the same story at Erlanger.
I think we're hanging in there for now.
For some areas, it's the lack of supplies.
I'm constantly having to ask myself who can come off of which machine so that I can give it to somebody else, because I think this person is now sicker than this other person.
Doctors say it's not just an increase in patients, a record 330 in Hamilton County today, but the amount of oxygen a COVID patient needs is driving this demand.
Not only you have more people that require oxygen, but a lot of them are using a higher amount, a higher flow of oxygen.
That was Sam Britton reporting. Orlando residents have actually been asked to stop watering their lawns and washing their cars because the city treats its water with oxygen. Last year's flu season was heavily impacted by COVID regulations and stay-at-home orders. This year, though, that's not the case. Brianna Idzior has more on how some doctors believe the shot could help reduce the serious illness as COVID cases continue to surge. Brianna.
COVID continues to devastate our community, but what happens when the flu is added into the mix? Erlanger and CHI Memorial doctors told us what the risks could be for this year's flu season. COVID vaccines have been the focus for the last few months, but now we're entering flu season, a season that Erlanger's Dr. Hyde said didn't really come last year.
I saw one case of the flu last year, which is normally my bread and butter in the winter.
She said this was largely because of strategies like wearing masks and social distancing that aren't as common this year, which could likely imply a worse flu season. CHI's Dr. Mark Anderson said it's
almost certainly it's going to be worse than last year.
But there's another factor making things worse. COVID. A group of doctors did a study that was published in the Public Library of Science that found that the flu vaccine could lead to less serious COVID-19 illness. Dr. Hyde said although participants who got the flu vaccine and then got COVID had less severe complications than those who did not get the flu shot, it's unclear if this is directly linked to the flu vaccine or their health behaviors.
Could there be something there? Definitely.
But in her opinion,
in terms of using the flu vaccine as a prevention measure for COVID, we should be using the COVID vaccine for that.
But something she knows for sure is that getting the flu and COVID at the same time is something to avoid.
So you're essentially getting a double whammy of infection that can be particularly devastating and hard to fight off.
Especially while Erlanger and CHI are both overwhelmed with COVID patients.
It could increase stress on our already stressed system all over the country, including in our community.
And if we had flu hit on top of this, it would be even more catastrophic than what we're experiencing right now.
The CDC said that since fewer people had the flu last year, there was less population immunity built up, so that could mean this flu season will come sooner and be more severe.